I will take a few minutes of short introduction. Can I have the next slide, please? Okay, these are my disclosures. Okay. To those of you who just wonder what is the topic of today, probably it's not necessary to most of us just to remind all of us that we are talking about clonal stem cell disorders, bone marrow stem cell disorders, characterized by abnormal hematopoiesis. The basis is genetic as well as immune and inflammation. Anemia is the hallmark, but cytopenia also are present. The median age is 74. The incidence increases with age, and patients are usually classified as either belonging to the lower risk or the highest risk group, and there is a leukemic transformation in 20 to 60% of the patients. How can I? Okay. Now, this is going back. This picture was kindly given to me by Dr. John Bennett, and you can realize the people at my age can realize the faces of the French, American, British group, which they were the first to nominate and to say the name MDS, myelodysplastic syndromes. And yes, we have made a nice progress since then, but still there are challenges which we are all trying to overcome. The challenges are in the etiology, in the pathogenesis, diagnosis, classifications, and treatments. And the words in bold are those points that will be addressed today in our symposium. We left some issues for the next meetings as well. Dr. Magnus Tobiasen will start with minimal residual disease. You know, traditionally, we used two endpoints which were very easy for us, just the survival and leukemic transformation. But life, as my children used to tell me, life is more complex, and life is not that simple. And there are now many patients who undergo several lines of treatment. They benefit from longer survival. The disease is more heterogeneous than we decided and we thought initially. So we got to have additional endpoints, and MRD is one of them. In fact, in other diseases, that has already been the case and the standard. And Dr. Tobiasen will tell us and will explain more how to use it. Is it the time to use it in MDS as well? Now, red blood cell transfusion, despite being probably the oldest method of treatment, is still somewhat controversial, and there are still many open questions. So one of them is, what's the hemoglobin to be transfused, and shall we apply liberal or more restrictive policy? So Dr. Rina Buxton from Sunnybrook, Toronto, will try to convince you that the liberal approach is the right one, but Dr. Esther Oliva from Italy will not agree with her. Now, the pathogenesis is becoming more and more clear, although there are still many open questions. One of the major points of the last decade is realizing that inflammation, and especially inflammation that is associated with aging, inflammation is becoming very important. So this raises the question, can we start treating our patients with anti-inflammatory agents? So Dr. Lachelle Weeks from Dana-Farber is sure that the answer is yes, but Professor Lionel Hades from Hôpital Saint-Louis in Paris will disagree. He does not think so yet. Now, germline mutations, for many years, myself and others, adult hematologists, thought that germline is just a matter of pediatrics. These are rare and are not really clinically important. Well, we turned to be wrong. It happens to be not that rare, 6 to 7% of the patients. It might be detected at adulthood, and it is clinically relevant. And Dr. Yaroslav Maciejewski from Cleveland Clinic volunteered to explain to us why it is important and who should undergo germline mutations. And high-risk MDS has always been a problem. Now, it has been now more than a decade that we have all learned that hypomethylating agent should be the first-line treatment. But so far, we haven't been able to overcome the strange rule of the 50% response and the duration of 2 years, maybe a little bit less, maybe a little bit more. So can we improve it? So Dr. Ghulam Mufti, one of the kings from King's in London, will try. He is usually not really a conservative, he's usually a reformer, but today he volunteered to be a conservative and to explain us why hypomethylating agent monotherapy is still the right thing to do, but Ari Goanidis from Düsseldorf does not agree with him. And yes, we have patient discussion, and just to remind all of us that things pretty simple when you see the curves or the table in the slide of a lecture, but we all know that when you come to the real patient in practice, things are not that easy. So we are going to present 3 patients just to demonstrate it and to discuss these patients. And before, wait a second, just, can you go back? And before the co-chair, Dr. O'Connell, will close, I would just like to thank again the MDS Foundation for hosting this symposium, Dr. Steven Neimer, Dr. Tracy Raka, and a special thanks to Leah Harrison, who really made this symposium possible. So thank you, and I'll turn the mic to Dr. O'Connell.